I'm back. Had to get myself together. Again, I'm Bianca, Calista's mom. So I just wanted to continue the story. I just had a little moment. I got myself together. I'm back. So basically, the plastic surgeon came in. He said everything went well. Explaining the jaw distraction again is basically because Calista basically doesn't have this part. You see how pronounced my jaw is? The point of the jaw distraction is to help this part grow on its own. And it sounds painful, and from what he explained, it is painful. She will be in a lot of pain, but we'll get to that. So basically what they do is they break this part in half. They put a metal device in its place, and the device has these, like, it's almost like a machine, or I think that's how I'm saying it. They have these things connected to it. And it's like these switches, let's call them switches, that they place on the back of her ear. Switches, little knobs. One knob here, one knob here. And these knobs have keys that go with it. And you take the key and you put it in the knob and you turn it clockwise. Turn it clockwise. So when you turn it, it helps this part move out. So it's like this. When you turn it, it moves. So you have to move it. You have to turn the key once in the morning, once in the evening, every day. So it moves. And the more it moves, it helps new bone. New bone will form. New bone. So you're moving it. New bone. No, I'm sorry. It's this way. So it either goes this way or this way. I'm not 100% sure. So let's imagine it's this way. You turn the knob, it'll grow. Turn the knob, it'll grow. You turn the knob, it'll grow. However, the keys can go clockwise and counterclockwise. And it's very important to make sure on both sides you are turning it clockwise, because if you turn the key counterclockwise, instead of it going this way or this way, it will push in like this, which will do damage to your jaw. So he said the doctor explained to us, like, we have to really be careful of how we turn the keys, because that is a very crucial part. And every time you turn the key, and it's further breaking her jaw, like this is just breaking it even more, just continuously breaking it, so that new bone can form on its own. Every time, so that new bone can form on its own. So every time you turn the key, it will hurt. So you have to I am going to have to give Calista some pain medicine like 30 minutes before I am going to turn the key, to kind of reduce the discomfort. So he explained that to us. He explained what it's supposed to look like, and that she will have some blood leaking from the incision site. That's normal. That we have to make sure she doesn't have any nerve damage or paralysis, or we'll be looking for that. So he did a really good job. Her surgeon did a really good job of like giving us all the information possible that we would need. Of course, none of this was written down yet, so when you hear it, it's hard to remember it when there's so much going on in your head. So I hope that I will be able to see him again and he'll explain more. But after he talked to us, we had to wait a while before we were able to go back and see her. They placed her in the ICU. When we did get to the ICU, I was a little disappointed because she is not in a private room. The ICU she's in looks just like an emergency room, so it's only these drapes. She has a very small space. She has a nurse that's assigned to her, and only her. Her desk is like right in front of her, so the nurse is looking at her constantly. And she has all these machines on this side and machines on that side of her. I will post pictures on my Facebook if you want to see, or don't worry, I'll take this computer when I go to the hospital today, take a picture, try to upload some for you, or do a video upload of what she's looking like now for you. So I'll show you, but she's in a really small space, and they decided that they were not going to take the tube out. They were going to keep her intubated. Intubated is basically when you're on a machine that is breathing for you, so you don't have to breathe on your own. So they're keeping her intubated for 2 to 3 days. Bye. Sorry, I'm at home. They're keeping her intubated for 2 to 3 days, so that because her airway is swollen, and they don't want her having issues to breathe on her own. So because she is intubated, she has to stay sedated, because they don't want you to be awake and you got something in your throat. Is very uncomfortable. So she will be sleeping for 2 to 3 days. And so because of that, I decided to go home last night, because the space she was in and the way the nurse was stationed and constantly dealing with her, I just felt like I was in the way. You know, they had a chair for a parent, but the chair was behind the bed, behind the machine, so you don't really see nothing. And it was awkward, and I felt like I was in the way, and I really wanted the nurse to do her job. So I felt it was best for my situation if I just left, because she is not going to be waking up, so she doesn't know that I'm here, and I could get some rest. So when they do take the tubes out and they do wake her up, I can really be there for her the way she's gonna need me to be there for her. That was my decision. The nurse, she was really good. She really made me feel comfortable. She really, I don't know if this is what their job is, but she really made me feel like she cared about Calista, so I felt confident that she was in good hands. The sad part was when she did wake up, when we were there. And when she woke up, she was really uncomfortable. She started freaking out. She was like this, and it took 4 nurses and my husband to pin her down, because she's feisty and she's strong, to pin her down so that they can give her more medicine through her IV to sedate her again so that she can sleep. But yeah, the whole thing, it was a roller coaster. It was a good one, though. It was a good ride, because thank God that nothing happened. There was no complications. They mentioned before surgery, if they felt like they couldn't intubate her well, that they would do a temporary trach. So I was happy that she didn't need one. Her face was swollen after, but that's normal, and there's nothing left to do now but just keep an eye on her, wait till she's extubated. That's the opposite, like when they take it out and they wake her up and see like how her motor function is in her face. And I'm just hoping that everything's fine and she's fine. And I feel like the hard part has not started yet, honestly. I feel like the hard part is going to be when she's awake and she's in pain. The hard part is going to be, like I said, turning those knobs. I haven't done it. I still haven't seen the knobs because they had all this dressing on her and these pillows, so you can't see nothing. All you can see is like this much of her face, which looks fine. So it's just, I'm scared. I want to do it right. The doctor explained that sometimes when you turn it clockwise on this side, you can make the mistake and turn it counterclockwise on the other side. So I will have to be doing training with that. So if you or anyone is getting a jaw distraction, That's a good piece of information to know. Is the way to turn the keys is crucial. I'm always going to keep you updated on what's going on and how it works out when I have to do it. I've been home. As soon as I'm done here, I'm headed back to the hospital, and I'll record some things so you can see her and see what it's like, so you can really get an idea of what to expect or what it was. But thanks to everyone who's thought about her, who's followed her, who's prayed for her, who worried about her, who decided to check in and know what happened. Like, it means a lot. My son Jonah is still breaking out in hives, and so tomorrow or today we'll take him, because he's allowed to come up there and see her for himself. So I'll keep you posted on that. All right, till next time.